Cygnet Heathers is a 20-bedded specialist neuropsychiatric and neurodegenerative service for male service users based in West Bromwich.
Our service is located in West Bromwich. It's close to Great Bridge, which is the local high street. There's a selection of local shops and cafes, barbers, which the guys can access. We are on local transport links into West Bromwich and Birmingham, which the guys use for shopping. They can access the local leisure centre, so go into the gym, they do swimming, playing tennis. We also have a local nature reserve which the gents can access, whether that's just for a walk or to feed the ducks if the weather's nice.
We get a wide range of patients who has got neuropsychiatric disorder. Most commonly what we deal with is patient with acute brain injury. Then we have got patients who has got mental and behavioral disorder due to brain disease, damage and dysfunction. We also have got individuals who has got a significant change in their personality and behavior and meet the criteria of organic personality disorder. We also have got patients who has got epilepsy and epilepsy-related illness like post-ictal psychosis. We also see patients with neurodegenerative disorders like Huntington disease, Parkinson's disease.
Here at Heathers we have 2 communal lounges and we have a quiet lounge. We have a therapy room which the gents can access to play games, board games, there's a pool table and darts. We also have a therapy garden. We have a gardening group where they grow salad and vegetables. There are 3 communal kitchens which the guys access to make their drinks and do their cooking sessions. All of our 20 bedrooms are en suite. And we also have a gym which they have their own personalised gym plans or they do sessions with the physiotherapist.
Our aim is to provide the very best care and treatment to our patients. We teach them new skills, we aim to consolidate those skills before they take them into the community and have a successful life living with their family in the community.
Our multidisciplinary team consists of the responsible clinician, the specialty doctor, there's myself, the head of care and the hospital manager. There's also a psychologist and we have 2 assistant psychologists. We have 2 OTs. We have 2 speech and language therapists, we have therapy coordinators, a physiotherapist. We also have our nursing team, which consists of mental health nurses, learning disability nurses and general nurses, and then we have our support staff.
We assess the person's cognitive, emotional and behavioural needs and take their social history, and we combine that information with information from other disciplines to come up with a shared understanding or a formulation of that person's need, and that's what we use to guide their intervention. We usually provide some kind of cognitive training, so teaching compensatory skills to deal with areas of cognitive impairment or weakness. And because emotions are often more difficult to deal with after brain injury, we often also need to teach new skills for accepting and dealing and understanding those new emotions. This can also involve helping that person adjust to their life after injury or finding new ways to cope with emotions if they've been relying on unhelpful coping skills such as drugs and alcohol. We offer 3 groups. We have a coping skills group, which the individuals share their experiences of emotions, what triggers those emotional states and how they cope with them. We also provide a relaxation skills group where we introduce them to different relaxation skills and mindfulness skills. We also have a brain gym group where they complete games and puzzles that test different cognitive skills, and then following that they share what kind of strategies or tricks they've used to make that task a bit easier, and we discuss how could you apply those in your day-to-day life.
My role as a speech and language therapist, we kind of look to maximise individuals' communication. We complete assessments, we provide intervention to ensure that patients have the ability to communicate effectively with others around them, to also making sure that their needs and their wants are met. We support any deficits they have to kind of make sure that their skill is maximised to the best of their potential. We also support patients with any swallowing disorders, so we're making sure that individuals individuals eat and drink safely to reduce the risk of choking or aspiration.
The support I provide at Cygnet Heathers are the interventions to improve and maintain their global fitness, their global strength, gait re-education, balance and coordination work. My main goal at Cygnet Heathers is to keep my service users active, but not just supporting them in the in-house gym, but also accessing the community facilities and preparing them to live in the community independently.
This is a very unique service, not only regionally but nationally. Our referral comes from all over the country. One of the most unique aspects of our service is that we have got a defined care pathway for any neuropsychiatric patient. And what I mean by that is, it's not about doing an intensive neuropsychiatric rehabilitation in a hospital setting, but we also have got a community service within the vicinity of the hospital that called Meadows Muse, where we actually transferred those patients from hospital to Meadows Muse to test their abilities and resilience to manage themselves in the community setting.
In February this year, Headway assessed us under their approved provider service. Gaining the outstanding this year from being good last year was a real lift for the staff and patients at Cygnet Heathers. We worked hard to prove to the assessors that we were an outstanding provider of care and services for patients, and we're really pleased with the outcome that we had.